You are listening to the Pregnancy Podcast with Vanessa Merton. Hello. Thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about protecting your mental health and talking about the baby blues and postpartum depression. Now, before you skip right over this episode, I know that as soon as most expecting moms hear the words postpartum depression, they're going to tune out and skip right over this topic. If you have never experienced depression, this is the last thing you think you need to know about, especially at a time in your life when you expect to be the happiest. Baby blues and postpartum depression are a complication of birth. And before you think that this could affect you, the baby blues are estimated to occur in about 50% or more of new mothers. Some studies even show a higher prevalence at nearly 80%. 1 in 7 moms will experience postpartum depression, and 40% of those will have an onset after birth. So that means that they didn't have depression before that. Over the last few decades, there's research showing that the number of new moms who get postpartum depression is increasing. So in this episode, we're going to talk about the symptoms of the baby blues and postpartum depression, how to get help, and how to protect your mental health postpartum. This is a very important episode. If you want to blow through this episode at 2 times speed, you can do that. You can also skim through the article for this episode on the website if you'd rather just skim through and read it. I urge you to not skip over this topic. You can find the complete article, all of the resources for this episode at pregnancypodcast.com/babyblues. You are on the public feed of the podcast. Get ad-free access to every single episode when you become a Pregnancy Podcast Premium member. That includes hundreds of episodes with evidence-based information that you won't find anywhere else. Check it out at pregnancypodcast.com/premium. Of mind, both at home and on the go. Check out the VTech Smart HD Plus at pregnancypodcast.com/HD Plus and save 20% with the code VTPodcast20. Centella asiatica is an incredible herb that has been shown in clinical studies to effectively prevent stretch marks in up to 89% of pregnant women. The best product with this ingredient that I found is the True Belly Serum by 8 Sheep Organics. It contains 85% pure Centella asiatica extract and is specially formulated to effectively prevent and fade pregnancy-related stretch marks. Like all 8 Sheep products, it comes with a 100-day happiness guarantee. Try it risk-free for 100 days. If you feel like it has not worked for you or you're not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out the True Belly Serum and get 10% off when you go to pregnancypodcast.com/8sheep. That's the number 8 and sheep like the animal. 8 sheep. One study that examined over 39 million births from 2006 to 2015 found that perinatal mood and anxiety disorders and serious mental illness more than doubled during that decade. More recent research shows that numbers are only continuing to rise. If that's not enough of a reason to be educated about this topic, even if you do not experience postpartum depression or the baby blues, you may have a friend who does, and you can be a great resource to assist them in getting help. A lot of times people with postpartum depression may not be aware or may not acknowledge that they're depressed. So if you suspect that a friend or a loved one has postpartum depression, you can help them to seek additional resources and tools. Anyone dealing with this should not just wait and hope for improvement or just try to power through it on their own. The best thing you can do is talk to your doctor or midwife and get access to tools and resources that can help you. Why are so many moms struggling with their mental health after birth? The baby blues, postpartum depression, these are a complication of birth, and they happen due to the many changes that you experience after you have your baby. Scientists don't have a completely clear answer as to what causes this, but there are factors that we know contribute to it. Number one is a sharp drop in hormones after birth. This is the most significant causative factor we're aware of. After the birth of your baby, your estrogen and progesterone levels drop very sharply, and that can cause mood swings. Other hormones that your thyroid gland produces can also decrease. That can make you tired, low energy, or depressed. Changes in your thyroid are very common after pregnancy. So if you have ever had thyroid issues, or if you have a history of them in your family, it's a good idea to request to get this checked after you have your baby. Another contributing factor is a lack of sleep. As a new parent, you can expect to get less sleep, and you can expect to have your sleep disrupted. Infants don't sleep in one long stretch overnight. They sleep in a polyphasic pattern. So that means it's on and off throughout the day and throughout the night. Babies are hardwired not to sleep for long periods. In fact, breastfed babies will sleep for shorter stretches than babies on formula. And that's because breast milk is easily digested, so your baby needs to be fed more often. Even when you look at studies on sleep in babies, researchers define sleeping through the night as 5 to 6 hours. Your baby won't start falling into a day and night rhythm until around 3 or 4 months old. And by about 1 year, they should be sleeping for a relatively long stretch at night. They're going to be taking several naps during the day. By age 4, they should sleep longer at night with 1 daytime nap. So the big takeaway here is that there are very few new parents that are getting 8 hours of sleep every night. The more scientists discover about sleep, the more we know how critical it is for your mental health. Every single mental health condition is associated with disordered sleep. And this can create a vicious cycle. If you're struggling with your mental health, it can negatively affect your sleep, and poor sleep can negatively affect your mental health. And this can be very frustrating, especially as a new parent, when you have a lot less control over your sleep schedule because you're dealing with the demands of a new baby. Another factor is birth recovery. Pregnancy and birth are very physically challenging. And after you have your baby, it's going to take time for your body to recover. During pregnancy, your uterus increases in size by 500%. And so after birth, it has to shrink back to pre-pregnancy size. That can take 8 to 12 weeks. During this time, you're going to have lochia. That's like a period, but much heavier. That can last up to 8 weeks. As your milk comes in and you're adapting to breastfeeding, you're going to have a lot of physical changes in your breast. Those are also very demanding. And throughout all of this, your body is working hard to recover from birth. There's a great episode, it's actually an interview, that gets into a lot of details on birth recovery. It goes through a lot of aspects of recovering from birth, a lot of things that nobody tells you about, and I'll link to that episode. All of the physical changes that are going to happen after you have your baby can also negatively affect your body image. A review that included 19 studies looked at body image and how it affected postpartum depression. Most of the studies found that body image dissatisfaction is consistently associated with the onset of prenatal and postpartum depression. Some studies even looked at the reverse and found that depression contributed to a negative body image. In addition to everything that's going on after birth, you're also responsible for caring for a new baby, and they rely entirely on you for survival. And if this is your first baby, you may have even more anxiety about how in the heck you're supposed to care for a newborn. So you can see there are a lot of contributing factors, and together these create the perfect storm to be bummed out after you have your baby. The baby blues is so prevalent. Again, this is estimated to occur in about 50% or more of women. Some studies even put the prevalence at near 80%. The baby blues includes mood swings, crying spells, anxiety, difficulty sleeping. Some other signs can be sadness, irritability, feeling overwhelmed, reduced concentration, and a reduced appetite. The baby blues typically begin within the first 2 to 3 days after you have your baby. But the good news is that it disappears pretty quickly within 1 to 2 weeks on its own. 1 in 7 new mothers will experience a more severe, long-lasting form of depression known as postpartum depression. For some of these moms, it'll show up before or during pregnancy, but 40% of mothers who have postpartum depression have an onset after birth. Postpartum depression can initially be mistaken for the baby blues, but the signs and the symptoms are going to be more intense and they're going to last longer. Eventually, it can interfere with your ability to care for your baby and handle daily tasks. Symptoms tend to develop within the first few weeks after birth. It is possible that they can take longer, sometimes up to 6 months after. And the list of symptoms for this is long, but it's important to know what to look out for if you encounter this. Some signs of postpartum depression are a depressed mood, severe mood swings, excessive crying by you, not by your baby, difficulty bonding with your baby, withdrawing from family and friends, problems with your appetite, insomnia or sleeping too much, overwhelming fatigue, reduced interest in activities that you used to enjoy, intense irritability and anger, fear that you're not a good mother, feelings of worthlessness, shame, guilt, or inadequacy, a diminished ability to think clearly, concentrate, or make decisions, severe anxiety and panic attacks, and can even include thoughts of harming yourself or your baby or recurrent thoughts of death or suicide. Those last symptoms refer to a rare complication of postpartum depression, and that's postpartum psychosis. This is a severe mental health illness and a psychiatric emergency. Symptoms usually start suddenly within the first 2 weeks, often within hours or days of giving birth. Symptoms include hallucinations, delusions, manic or depressed mood, a loss of inhibitions, feeling suspicious or fearful, restlessness, feeling confused, and behaving in a way that's out of character. I'm not including this to alarm you, but just so that you're aware of it. Postpartum psychosis is rare, but it does require immediate treatment. And while all of this may seem very extreme, if you ever have thoughts of harming yourself or your baby, you need to immediately seek help from your partner or loved ones to help take care of your baby and call 911 or your local emergency assistance number to get help. It's important that you know that postpartum psychosis exists. And other than just briefly touching on this episode is really going to be focused on postpartum depression. Many factors can increase your risk of developing postpartum depression, and these are broken down into 4 categories: psychological, obstetric, social, and lifestyle. Psychological risk factors include a history of depression and anxiety, PMS or sexual abuse, a negative attitude towards the baby, the reluctance of the baby's sex. Obstetric risk factors are related to your pregnancy. Those can include having a high-risk pregnancy, if you have an emergency cesarean, if you're hospitalized during your pregnancy, complications like having meconium in your amniotic fluid, an umbilical cord prolapse, preterm or low birth infant, and low hemoglobin are also risk factors. There's social factors that can increase your risk, like a lack of social support, or if you experience domestic violence. Your lifestyle also plays a significant role. That includes your eating habits, sleep, and exercise. Smoking during pregnancy is also a risk factor for developing postpartum depression. If you have one or more risk factors, that doesn't guarantee that you will experience postpartum depression, but it does statistically increase your risk. Some of these things are in your control, or they're things that you can mitigate. So that means that there are things you can do to actually lower your risk of developing postpartum depression. And we'll talk more specifically about those later in this episode. There are several tests that can be used to screen for postpartum depression. A screening test doesn't diagnose a condition. It only identifies whether you should have further tests to either rule out a condition or to get a possible diagnosis. The most commonly used screening test for postpartum depression is the Edinburgh Postnatal Depression Scale. This is a 10-question survey. Each question is scored from 0 to 3. There's a maximum score of 30. It's 10 multiple choice questions, A score of 10 to 14 represents mild symptomology, 15 to 19 is moderate, and a score of higher than 19 is consistent with severe symptomology and an increased risk for bipolar disorder. I'll put a link to the Edinburgh Postnatal Depression Scale. You can take that anonymously online. Again, it's just 10 multiple choice questions. It's just going to take a couple of minutes to complete. Next, we're going to talk about what to do if you have any symptoms of postpartum depression or the baby blues, how it's treated, and also some things you can do to reduce your risk. Before we get into those topics, I want to thank the sponsors that have supported this episode. As the #1 baby monitor brand in North America, VTech is trusted by millions of families to deliver crystal clear HD video, reliable performance, strong night vision, and convenient smartphone access. The VTech Smart HD Plus is designed for families that want flexibility and peace of mind both at home and on the go. The Smart HD Plus has a 1080 pixel HD camera with a 135 degree wide angle lens. There's a 5.5 inch parent unit and free access to the My VTech Baby Plus mobile app so you can watch from your smartphone. You can remotely pan, tilt, and zoom. There's a multicolor nightlight, two-way talk, soothing sounds, and lullabies, plus infrared night vision and a private encrypted video connection. Check out the VTech Smart HD Plus at pregnancypodcast.com/HD plus and save 20% with the code VTPodcast20. Let's get back to today's episode. If you're bummed out after your baby's born, you may be reluctant or embarrassed to admit it. And please don't be. It is so important for you to know that baby blues and postpartum depression are not due to anything that you did wrong. And there's nothing wrong with you. They are simply birth complications. If you're struggling with some signs of depression, you don't have to be embarrassed or ashamed, and you need to know that you're not alone. There's so many women that deal with this, and very few openly talk about it. The good news is that if you seek help early on, you can manage your symptoms and get back to being a happy mom and enjoying your baby sooner. So if you're having any symptoms of the baby blues or postpartum depression, please call your care provider and let them know. If it goes untreated, postpartum depression can last for months or longer. It can interfere with bonding with your baby. It can make daily life more challenging. Don't wait until your next postpartum visit to talk to your doctor or midwife. Getting help as soon as possible can give you access to tools and resources that can improve your mental health quicker. Treatment and the time it takes to recover depends on the severity of your depression and the particulars of your situation. If you have thyroid issues or any other underlying illnesses, your doctor may treat those conditions first. You may be referred to an appropriate specialist. Your care provider may also refer you to a mental health provider. Treatment for postpartum depression is often mental health counseling or medication or a combination of both. With treatment, postpartum depression usually goes away within 6 months. Talking through your concerns with a psychiatrist, psychologist, or other mental health provider can be so beneficial. Therapy can assist you in finding better ways to cope with your feelings, solve problems, set realistic goals, and respond to situations in a positive way. Sometimes involving family or your partner in therapy could also be helpful. Another aspect of treatment may be an antidepressant. If you're breastfeeding, many medications will transfer to your baby in your breast milk. But there are some antidepressants that are approved to be used during breastfeeding with little risk of side effects to your baby. Any decision to take an antidepressant or any other medication while breastfeeding means that you need to talk to your doctor and really weigh the potential risks and benefits. There is a fantastic resource, the LactMed database, and that gives you information on medications and breastfeeding. You can type in the name of any specific medication, and get research-backed information on how the drug can affect you, your baby, or your milk supply. So if you're thinking of taking any medication during breastfeeding, even if it's something over the counter, of course you want to run that by your doctor or midwife. You can also put that in the LactMed database and find out whether or not it's safe to take when you're breastfeeding. And of course, I'll include a link to that in the article for this episode. There are things you can do that can hedge against the baby blues and postpartum depression, or that can help speed up your recovery if this happens. Many of these tips may sound a little familiar, and that's because they all refer to either a causative factor or to symptoms. And of course, there's some things that you cannot control. You can't do anything about major drops in hormone levels. But there are steps you can take to improve your mental health after you have your baby. If you just take one of these interventions alone, it's probably not going to make a massive difference. But when you stack these together, these tips can help protect your mental health. The first is your diet and ensuring you have all the necessary vitamins and nutrients that you need. That will help with your birth recovery, your energy levels, your overall health, and your mood. And you should be focusing on healthy whole foods. You should also continue to take a high-quality prenatal vitamin after you have your baby. There is some evidence that vitamin B6 has a positive effect on reducing postpartum depression among mothers at risk. As long as you're eating a wide variety of foods and you're taking a high-quality prenatal, you should get all of the vitamins and nutrients that you need, including B6. And of course, if you're considering taking any supplements, please run them by your doctor or midwife first. The next tip is to prioritize sleep. And all you can do is prioritize sleep as much as you can within the constraints of your parenting responsibilities. The cliche saying, sleep when the baby sleeps, is actually good advice. If your baby's taking a nap, try to close your eyes, even if it's just for a few minutes. Although, in reality, this can be a little challenging because your baby's nap times are the perfect time to get other things done, take a shower, knock off anything on your to-do list. Anything on your list can wait. You have to prioritize sleep. Naps can help make up for some sleep loss during the night. In a TED Talk from Dr. Matt Walker, he's an amazing resource for all things sleep science. He talks about that humans are hardwired to have a drop in alertness in the afternoon, sometime between 1 and 4 p.m. Naps can have benefits, but they can also disrupt your sleep. Dr. Walker advises avoiding naps if you struggle to sleep at night. If you're not struggling with sleep and you can regularly nap during the day, a short 20-minute nap earlier is fine. If you take a nap too late in the afternoon, that can make it harder to fall asleep at night. Andrew Huberman, who's also an amazing resource, recommends limiting daytime naps to less than 90 minutes, which is the length of a sleep cycle, or to not nap at all. Although it can be challenging to prioritize sleep, there's a lot of evidence-based things that you can do to improve your sleep. I will include links to 2 episodes on sleep. One really gets into those evidence-based changes you can make to improve your sleep, and the other specifically talks about addressing sleep issues during pregnancy and as a new parent. Another thing that you can do to help hedge against postpartum depression and the baby blues is to set realistic expectations. You're going to have a new baby, and no one expects you to have a spotless house, to have perfect Pinterest-worthy meals prepared every night. Do not look to Instagram to set your expectations of what being a new mom should look like. What you're seeing on Instagram or any other social media platform is purely the highlight reel. One study found that mothers who spend more time online engage in greater levels of social comparison, leading to increased stress and negative emotions. We're still learning about the consequences of social media and how it can impact your mental health. So if you're feeling mentally or emotionally drained after scrolling online, please take a break and limit your time on social media. There's a large body of evidence that supports a connection between social connection and physical and mental health. Humans are social creatures, and we're wired to connect to other people. A study examined 27 stress indicators during pregnancy, This included psychosocial, physical, lifestyle. Nearly 67% of women were in the healthy group. 17% were in the psychologically stressed group and had clinically meaningful elevations in perceived stress, depression, and anxiety. 16% were physically stressed with higher blood pressure and increased caloric intake. And the researchers found that social support contributed most to differentiating these three groups. And they looked at three forms of social support: others with whom to talk, to spend time, and on whom to rely for material help. When you're starting or growing your family, that's a massive life change, and it can really impact your lifestyle and the people that you connect with, especially if not everyone in your friend group is also having kids at the same time. Going through pregnancy and parenting alone or with little support from a larger community of friends and family makes everything more difficult. If you feel like you need a better support system, that's something that you have the power to change. There's always going to be people in your community or your area that are going through pregnancy or having babies. You can meet other expecting or new parents through an in-person birth class, through a local Facebook or meetup group, even at your neighborhood park. Social connection is so important, and it's not something that can be replaced online. The American College of Obstetricians and Gynecologists recommends that all women have contact with their care providers within the first 3 weeks postpartum. Now remember, the baby blues usually happen within a few days of having your baby and last 1 to 2 weeks. If you don't have your first appointment until week 3, you may skip that period entirely. Also, postpartum depression may show up after week 3. In which case it could be months until you see your care provider again. After that first visit within the first 3 weeks, ACOG recommends that it's followed up with ongoing care as needed, concluding with a comprehensive postpartum visit no later than 12 weeks after birth. ACOG also acknowledges that the National Institute for Health and Care Excellence guidelines recommend screening all women for resolution of the baby blues at 10 to 14 days after birth, and that's to facilitate early identification of and treatment for postpartum depression. Although that 10 to 14 day window doesn't exactly line up with their guideline for an initial appointment within the first 3 weeks. Although there's some guidelines in place, it's estimated that as many as half of cases of postpartum depression go undiagnosed. The longer you go without a diagnosis, the longer you'll struggle without valuable resources that can help. Please be honest with your doctor or midwife about how you're feeling after you have your baby. And if you have any questions about your symptoms being a sign of the baby blues or postpartum depression or something more serious, please get in touch with your care provider. And do not wait until your next scheduled appointment. Call them right away. And you may also request a referral to a mental health care provider who may be better equipped to assist you. Another great tool in dealing with postpartum depression is a support group. A support group meets regularly and is usually moderated by a knowledgeable professional. This also gives you an opportunity to connect with other new moms who are going through similar struggles. There should be a support group available in your local area. Your doctor or midwife could be a good resource to help track down a local support group. If you're having trouble locating an in-person support group or you prefer virtual meetings, you can also join an online support group. I'm going to include a couple links. One is for Postpartum Support International. They offer online support meetings and they have over 20 support groups, a lot of which cater to specific populations, like parents of NICU babies, military mothers. They have quite a few different categories. There's also Smart Patients. That's an online community that partners with Postpartum Support International that offers groups to connect you with resources and peer support. The last thing I want to touch on is that you're not the only one who may have challenges to your mental health after having a baby. Fathers can also experience a lot of challenges after the birth of a baby, including things like lack of sleep, anxiety, even changes in hormone levels. Research shows that partners and fathers can also experience the baby blues. One study found that at least 17.5% of fathers experienced postpartum blues. Researchers also found that the symptoms of postpartum blues were positively correlated with impairment in the father-to-infant bond. Feelings of sadness or depression in fathers after the birth of a baby happen most often during the first 3 to 6 months, but can develop up to a year after birth. I guarantee this is a topic that is probably completely unknown to your partner. If you think that your partner is having difficulty after your baby's born, please encourage them to contact their doctor. So many new moms try to power through the baby blues and postpartum depression without assistance. Please talk openly with your doctor or midwife about how you feel during pregnancy and after you have your baby. And you don't need to wait until your next appointment. You can reach out to them anytime if you have any questions or concerns. Seeking the assistance of your care provider is going to connect you with resources and tools that can make an incredible difference in how you're coping and how long your symptoms last. To recap today's episode, we talked about protecting your mental health postpartum and really got into the baby blues and postpartum depression. We talked about the changes after birth that create the perfect storm for this to happen. We talked about how prevalent it is, 1 in 7 mothers being affected by postpartum depression, over 50% of moms, maybe even as many as 80% dealing with the baby blues. We went through the symptoms, risk factors, how it's screened for, and talked about what to do if you have symptoms, how it's treated, and some things that you can do to help protect your mental health in the postpartum period. I want to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. Now, I know this is a topic that a lot of moms are going to skip over. If you know somebody that you think this episode would help, please share it. So many listeners find this podcast through recommendations, and I really appreciate you sharing it. As always, you can contact me, Vanessa, at pregnancypodcast.com. You can read the full article and see all the resources that accompany this episode at pregnancypodcast.com/babyblues. If you're looking for more evidence-based information, or you just want an ad-free experience, become a Pregnancy Podcast Premium member. You'll never hear another advertisement, and you'll get access to hundreds of episodes with evidence-based information that you won't find anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.